Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host from News Channel Nebraska, Grant Otten. I'm with Dr. Megan Faltys. Now, Doctor, it's been the first time I'm over here at Family Practice. Kind of just to start off, can you tell me a little bit about what you do?
Yeah, so I am a family practice doctor at Columbus Family Practice, and we have, there's 5 other physicians here and 3 mid-levels, and I actually work part-time. I work 3 days a week, and 3 days a week, and see all age ranges here. So.
Well, it's obviously a really good facility here. It's newer, but why did you decide to get into this kind of field of practice and being kind of a family physician?
Right. So I chose family practice because actually growing up, I grew up on a farm, and the only doctor we had was a family practice doctor. So to be honest, when I thought of a doctor, that's what I thought of. And, you know, he delivered my siblings, he took care of us, he took care of my grandparents, even at their dying days. And so he just made a profound impact on me. And actually, my first job out of residency was at the clinic of our family doctor after he retired. Oh, wow. So, and then through a very fortunate turn of events, I ended up here in Columbus. So.
Oh, very cool. Well, I guess let's talk about that as well, kind of why you chose to be here in Columbus, and then what is it like been practicing here in the Columbus area?
Yeah, so I came to Columbus 3 years ago, and I had worked in Clarkson, Nebraska, which again was a great place to work, but just through, again, a series of events, my kids went to school here in Columbus, and it just so happened that I was able to join the practice here, and it has been a really awesome change. The community in Columbus is very great. It's rural, but yet we have enough specialists. It's just a great medical team. So just whenever you have a question, and I just feel like we all work together. So if a patient has a diagnosis that needs to be addressed that day, you just call up, one of your colleagues and just get them right through the system. So it's just a really great community here, and it's wonderful.
Well, let's talk a little bit about your educational background, and I guess what maybe I'm sure some people are curious about is, does it differ when you're deciding to go into being a family physician? Because you guys kind of deal with everything.
Yeah. So I actually I went to Chadron State College for 2 years out of high school. I went to Schuyler to school, so I'm kind of from the local area. And then I went to Chadron State College for 2 years, where I was in the RHELP program, but then actually transferred to University of Nebraska in Lincoln, and had graduated with my biochemistry degree. And then I went to the University of Nebraska Medical Center for medical school, kind of thinking that I, likely was going to be a family practice doctor. And actually I loved every rotation, so I guess that confirmed that I needed to be a family practice doctor. And then I did training I stayed for residency at UNMC, and I actually did a special residency program where I actually skipped my 4th year of medical school and did an extra year of training in order to be more well-versed in different areas of family medicine in order to go out to a rural area.
So being here at Family Practice, as we talked about, you guys do a lot of different things. What is it like as being kind of a coordinator of care for some of these patients?
We have patients with multiple chronic medical conditions like diabetes, heart disease, heart failure, thyroid issues, high blood pressure, and we are able to look at all the medicines and make sure that the medicines are having a beneficial instead of a harmful impact. Because sometimes when you get too many medicines, if you go see your cardiologist and then you go see your kidney doctor and then you go see your endocrinologist, if you have those specialties, they're just focusing on that one disease specific and process. And so when we look at all the medicines, we can maybe see and look at the overall health, whether or not some of those medicines may be interacting with each other. We can also talk with you about the goals of your care, because not everyone wants everything done. Maybe your goal of care is not to live till you're 100, but to live the best possible life that you can. And sometimes certain specialties may not focus on that because they don't know you well. But when we know you and your family and what you want out of your health care, we can help coordinate that so that you can live the best possible life.
Awesome. Well, Doctor, thank you so much for joining me. It was a pleasure to have you.
Yeah, great. Thank you.
All right. Thank you guys as well for tuning into another edition of Meet the Doc, sponsored by the Columbus Community Hospital. I've been Grant Otten from News Channel Nebraska. We'll see you next time.